Hi, thanks for tuning in to Dr. Podcast Show. We really appreciate it. And if you like Dr. Podcast, please click on the subscribe and follow and like buttons. We'd really appreciate it. If you have any comments, please let us know. If you'd like to repost it, we'd appreciate that as well. The more often you click on the buttons, the more guests we have and the better guests we have. And today we have the greatest guest of all for a very timely subject, and that is bird flu. As you've probably seen in the news in the last few weeks, there have been cases of bird flu spreading through birds, mammals, cows, and now there has even been a case in a human. And today, I'm really pleased to have one of the world's top experts, if not the top expert on flu. We have Dr. Peter Palese. Dr. Palese was the chairman of the Department of Microbiology at the Mount Sinai Medical Center and Mount Sinai School of Medicine in New York City, very prestigious institution. And he's been the chairman there for 36 years. Dr. Palese is also world famous for making numerous discoveries about the flu virus. So I'm going to go over some of his incredible credentials. He reconstructed the 1918 Spanish flu virus, which you may recall over 100 years ago killed about 75 million people worldwide. And Dr. Palese actually reconstructed that virus to figure out what was so deadly about it. He also created the first genetic maps of the flu A, flu B, and flu C virus. His discoveries have also led to the presence of antiviral drugs, which are used to treat many flu infections. He's a fellow of the American Academy of Arts and Sciences, a very prestigious title. He's a member of the National Academy of Sciences, which is also extremely prestigious. He's written over 500 papers as well as numerous chapters on virology and especially the flu virus. He's named in over 75 patents having to do with various viruses. And incredibly important, he's now working on creating a flu vaccine that would last for perhaps a lifetime or at least many years. As you know, currently the flu virus vaccines last only about a year, and you have to get a new vaccine every year. So hopefully Dr. Palese will come up with a long-standing flu vaccine. Dr. Palese, thanks very much for coming today. I really appreciate it. You are an extremely busy man, so I really appreciate your taking the time to join us today to talk about bird flu and flu in general. Can you tell us how you got interested in microbiology initially and then in virology?
I thank you very much. Your introduction really shows that you did your homework. Yeah?
I did.
Very, very well. I have been in this field for quite some time now. And let me just say it's the last century. And I have been interested in viruses, if they are particularly in respiratory viruses. And influenza happens to be one of the respiratory viruses which still causes us a lot of problems.
Right.
And I have been working in this area for really quite some time.
That's how did you become interested specifically in viruses and then the flu? Was there any event that led to that, or you just happened to?
Unfortunately, I don't have a good story. I just slipped, so to speak, into it and got more and more interested. So I apologize.
No problem. Right now, everybody is talking about the bird flu. I see it on TV, it's in the newspapers, it's all over the internet, and it's kind of frightening to many of us. The bird flu is referred to as H5N1 flu virus. Some of the other flu viruses, for example, are H1N1. Can you tell us what the letter H stands for and the letter N and why those numbers change?
So let's, as I mentioned before, we had the Spanish flu in 1918, more than 100 years ago, and we had about 75 million deaths at the time in a very brief period of November 1918 to January 1919. And we had probably a third of our world population now. So if you argue you have 75 million deaths, plus or minus, and we have now 3 times as many people in the world, that translates into 200 million deaths. Yeah? And that one is really something quite dramatic. I don't want to belittle COVID-19, but we had only 8-9 million people dying. And,
so the flu could be 10 times worse, if not more.
So clearly, I mean, we all know this was a terrible thing, COVID-19, but compared to the 1918 influenza virus pandemic, global epidemic, it is still somewhat less, had less of an impact, you know, the last pandemic. Now, the influenza virus is characterized by variation. And we will talk about probably more how this is manifested, but just have that in mind as a take-home lesson. The virus changes constantly. And that is one of the difficulties we have, that in contrast to other viruses, such as measles, for example, measles virus has been the same for the last 60, 70 years, and we still use the same vaccine which was developed 60 years ago. With respect to influenza viruses, that's different. The virus is constantly changing. And what is it that changes? And that's is a long-winded answer to your question, what is the H and the N stand for?
Right.
And the H stands for hemagglutinin, which is a property of the virus that it agglutinates red blood cells. And then we define these different hemagglutinins as H1, H2, etc. And the N stands for neuraminidase, which is another one of the surface glycoproteins of the virus. So H and N defines these different influenza viruses, and we have actually quite some number of different hemagglutinins. We humans have only experienced H1, H2, and H3, but there are many others, 4, 5, 6, etc. And the H5 is the bird flu, and that is one which is very different from the H1, H2, and H3, which we have as humans experienced. And the difficulty is, you know, that the virus can constantly change. It is unpredictable, and we have particularly a problem with this H5N1 virus, which has been known to us to have infected birds for many, many decades, but really has it jumped from birds into humans. Now, what is attracting our sort of worry, that the H5N1, which has been found in birds, and many, many times, wild birds, migratory birds, but also in chicken farms, etc., has now been found in cows. And that is something which we haven't seen. And it has happened really in a very brief period of time in, I think it's 7 states right now,
Right.
where where people have experienced that the H5N1 jumps into cows. And that is worrisome for the cows, obviously.
Right.
Because one of the things is that cows which have been infected with the virus don't give good milk or no milk at all. So I'm not talking about that the cows die, which is not yet, with the H5N1 virus presently identified in cows, has not yet caused any death. However, we know many of the cows are used to make milk, to make cheese, etc. And that one is really very, very difficult. And we don't know exactly why that is, but cows which have been infected with the bird flu H5N1 is really are compromised in terms of providing enough milk, but also the milk is supposedly very sticky, and it's something which we haven't experienced, obviously, but something we are really worried at this point.
Right. Has the virus been found in the cow milk? And is there a possibility that our milk supply could be contaminated from cows that have had the infection with the virus?
You're absolutely right, Dr. Seiker. That's what has been found, that there is quite high titers. We call them units, plaque-forming units, and they are per milliliter 10 to the 7 of these virus particles in the milk. And yes, we are pasteurizing our milk. When we buy in the supermarket milk, it has been treated so that it doesn't contain bacteria, and it also would not contain small amounts of any virus. However, the levels of the H5N1, which has been found in the milk of infected cows, is quite high, so that it's not completely clear whether the present pasteurization process is enough to really kill every single virus particle. And it wouldn't be good if you have this virus transmitted from person to from the milk to people, right, and then cause more problems.
Now, when they get milk from cows, they kind of put it together from many cows and mix it. Possibly even different farms may mix milk together and then process it. So potentially 1 or 2 sick cows could contaminate hundreds of thousands or millions of milk bottles.
I should say, however, that the virus it has been around in pigeons and wild birds, and it has not caused really a lot of problems in humans. So it is, yes, it can be transmitted to humans, and there are about 1,000 cases have been reported over the last 30, 40 years. But it is not like measles, where, as we all know, if you have one person in a room, then
the whole room,
whole room can get it. So the bird flu per se, at least the one we have been dealing with, is not very able to transmit and really cause disease. There were 2 recent cases in the US of humans having not died, having been infected with the bird flu.
Right.
And in both cases, I think in one case it was a conjunctiva infection, and the other one was sort of a mild infection. So yes, these people have been infected with the H5 virus, but without, at least at this point, without dire consequences.
Right. But my understanding is, from what I've researched, is the 1,000 people who've been infected over the last 3 decades, there was about a 50% mortality rate total, which is...
I hope you wouldn't have mentioned that one. You're absolutely right.
There is a 50% mortality rate.
But so. I think one has to still feel more positive, because in those cases, there were large amounts of virus, really, particularly in poultry farms, and they may have really got a lot of virus, and that may explain this high fatality rate. In general, by just looking at a dead pigeon or some other dead animals who have contracted bird flu, it is not that easily transmitted. So it might be something, again, you are right, I didn't want to bring up the 50% fatality rate, and you are right, but I think these are special cases of people who have really dealt with chicken, poultry in a very close contact and with large quantities.
Right.
So I would like to think that it is not a measles virus in terms of how fast it can be transmitted and cause real problems.
The concern, though, is there have been many mammals reported catching this from poultry over the last few decades. I think 200 different mammals.
Yeah.
But those are mammals that humans don't have much contact with. Cows, on the other hand, have lots of contact with humans, so that's a concern. Why do you think it suddenly jumped to cows, and how does it get to 7 different states in such a short period of time? Is it something we are doing as humans, or has the virus somehow mutated to be able to transmit easily to cows from poultry? From, let's say there's a farm that has chickens and cows, they kind of hang out in the same place on the farm. So
Yeah.
is there a mutation that's occurred?
No, it's a very, very good question you bring up. Why has it happened now? I have to admit I have never heard it in my last 40, 50 years in the field that cows were infected.
Right.
So why did it happen, and why has it happened now? I think it's a very good question, but I think there is, at least from the few data we have, there is no real mutation in the virus from cows as compared to the one which has been in wild birds. So unless, and maybe one has to wait until more work is done and more of these viruses have been analyzed. But at this point, it is not clear why it happened now and why it happened. Did anything change with the virus so that it can easily, or that it can infect cows? And what is important, the cows are, I mean, big animals, and the idea that we would have to cull 1,000,000 cows, I think is something which we don't like to think about. And
Right.
as you know, in the US, when poultry farms are affected by bird flu, unfortunately, we kill all the birds, and I think in the last 1 or 2 years, several million birds have been killed in the United States because of bird flu. So that is something really dramatic in the chicken population, and if we have something similar in cows, I think a lot of people would feel very uncomfortable about that.
Yeah, that would be really bad. Let me ask you, the vaccines that we get annually, that I get, all my patients get for flu, will they offer any protection from the H5N1 or bird flu strain that's out now? Do we know that?
Yes. It's a very good question again, and I'm really pro-vaccination, and I think the current human vaccines are better than their reputation, and we can talk about it. And these are, I mean, not perfect vaccines, but very good vaccines, but only against these strains like I've mentioned before, which are human strains.
Right.
So
the H1N1.
H1N1, and there's also a flu B, and so we have these human strains, and the vaccines which are made and which I think are quite effective are effective against the human strains, but not the H5. So that is absolutely clear.
So previous vaccinations, even if you've had it every year for 20
or
years,
even every half year, would not have.
It doesn't help because the H5 is a different protein than the H1,
Exactly.
and so it's not going to help us too much. So are we producing H5N1 vaccine? Do
Yes.
we have enough of it?
Okay, so we have to first say in the US,
Right.
we do not vaccinate poultry against influenza.
Okay.
What we do is we try to ring ring them in somehow and actually eliminate and kill the birds.
Right.
In countries in the southern Southern America, and also in Egypt and in other countries, they do vaccinate against against the H5. And as a matter of fact, my colleague Gafir Sostri and myself, we have actually a patent on H5 vaccine in animals, and they have been using this for the last 10 years quite effectively, but not in the US. It is in Mexico and in other countries.
So it works to protect chickens and other birds?
In other birds. It has not been tried in cows, obviously.
Right.
And there was actually, we would never allow to use an H5 vaccine in humans as long as there's not a disease in humans.
What if there were, hopefully not, but what if there were an outbreak of H5N1 bird flu in humans? Would the pharmaceutical companies, the government, be ready to produce 400 million doses to protect the population and billions worldwide?
Yeah, so the question is, what can we do? Should this really jump into humans? And we are not in a situation like 100 years ago with the 1918 pandemic, where we first didn't know at the time what was this, a virus or bacterium, what it was. And also we had no vaccines and we had no antivirals. At this particular stage, we have very good antivirals, which also would be effective against H5N1. So the first line of defense is, Tamiflu is the one which
is... Tamvir or Tamiflu?
The Tamiflu or Zanamivir is another one.
I think you were involved in developing that, right?
I worked on the mechanism, yes. It's a very good drug. I don't have any stock with Roche, but it's a good drug. And the first defense we have are these antivirals. There are several antivirals. There's another FDA approved one, Balaxavir, and these and they are available in large quantities, and could be produced in very short.
Do you know if Roche is producing extra doses recently?
I'm sure they have. Yeah.
They have.
I wouldn't be surprised, and particularly also because we have been reminded that pandemics can occur, can happen, and I think. But also, I have actually some Tamiflu in my refrigerator because it's a very stable drug.
Oh, really?
The drug, the shelf life is probably, they say, 2 years, but in reality, I think they will outlive me easily. So it's a very safe compound and a very, very stable compound.
Right, but the recommended dose is 2 pills a day, morning and night, for 5 days. That's 10 pills. Yes. In the USA, let's say there's 300 million people. You would need 3 billion pills.
I think it's a fairly cheap product.
Right.
It's
so
chemically not very difficult. I think we would be able to do that.
Yeah. So let me ask you this. I've done some research on this. I'm not a virologist or infectious disease specialist, but it seems like the H5N1 has kind of slowly mutated over decades. Initially, it was found in birds and it spread to other birds. Then another mutation somewhere along the way occurred where it started spreading to mammals, such as ferrets and other types of mammals. So that was kind of another mutation of the virus which allowed to spread it to mammals. Then my understanding is it started spreading between mammals. So for example, one ferret can infect another ferret just from saliva that happens to go across a room in an aerosol. The new mutation now is that it's basically spreading to cows, which are a higher form of mammals. And my fear is the next step would be some kind of mutation that allows human-to-human spread via aerosol, saliva, and so on. Do you think that's happening here? I know it hasn't happened yet. There are no cases of human-to-human spread, but it seems like that's kind of the last mutation that would be very deadly.
No, Dr. Seigert, you have very well described what happened, and that these mutations can arise and accumulate and change the type of animal that gets infected. However, it is not predictable whether this would require from different species, such as a cow, to go to humans, whether it requires one mutation or two or even 10.
It may require many mutations.
So,
so that's unlikely.
And then it becomes less and less likely. One of the, I don't want to say hopes, is that this H5 virus has been around. And we talked about it has been found in chicken and in many other animals, but it has never really successfully infect humans.
Right.
So one could argue, at least in the last 50 years, there were quite a lot of possibilities for the virus, for the whatever the cow virus, or which we don't know whether that existed, but whether the eagle virus, etc. Whether they haven't, it hasn't happened. So in a way, I don't want to say it will not happen in another 50 years, but I think this is a consideration that it could have happened already and has not happened. So I interpret it as something that maybe it's not that easy to accumulate those mutations. But you're absolutely right. Never say never.
Right. So what you're saying is maybe it takes multiple mutations to occur simultaneously at the same time for that to occur. It's not just one
Or
mutation.
sequentially at least.
Or sequentially over a long period of time, and that would protect us.
Or shorter or longer period of time.
Yeah.
Yeah.
Let me ask you this. In my research to do this interview, I looked into the bird flu and its history. And I noticed that about 10, 15 years ago, there were some gain-of-function studies being done on the bird flu in Europe and also in the USA, specifically at the University of Wisconsin. And my understanding is that there were two slip-ups there. One of them where somebody accidentally injected their finger with a needle that had the bird flu on it. And there was another episode where there was a leak within the lab where some air may possibly have been contaminated with the bird flu virus. Now, there's no evidence that it spread beyond that laboratory, but is it possible that some of these gain-of-function studies may have resulted in a leak that we're not aware of, and then that is the cause for the spread from poultry to cows?
You said it very correctly that experiments which involve the change in a virus to be able to infect different species is referred to as gain-of-function experiments. So you're starting out with a virus in one species, and if you go into another species, it wouldn't infect it because the new host is too different. However, when you sort of take the other species and try to passage the virus in that other species, first it doesn't work very well, but if you do it 10 consecutive times, one may accumulate these mutations we are talking about, that there can be a change in species specificity. And I have been involved in this discussion of gain-of-function for some time. I would like to say that we, particularly the US, but also in Europe, that the conditions under which we do these kinds of experiments are very, very solid and very tried, and I think our methodologies are very, very good. Our laboratories are very safe. So I would really categorically like to say that there is no evidence that in this country or in Europe any of these experiments which have done and which could be interpreted as gain of function have actually resulted in a release or in a jumping from one species to the other.
That's good to know. I'm feeling more comfortable, but still there were 2 episodes of leaks at the University of Wisconsin. My understanding is the government actually shut down those labs for several years, and then eventually they were reopened. I'm not sure what the status is now, whether they're still doing it or not. But what I heard you say is Europe and USA, but there are other parts of the world that potentially could be working on this. And as you know, many people believe that the COVID virus was made in a lab in China and then leaked out of that lab. Now that the bird flu, H5N1, has spread to cows in 7 states, what's to prevent some rogue people or people with bad intentions from having access to that virus from the cow, potentially shipping it to Asia or some other countries out of Europe and the USA and working on gain of function? By the way, for the people out there, gain of function it's sort of a euphemistic term in my opinion. I think it should be called a gain of pathogenicity. It actually makes the virus more deadly and worse than it is. So, but anyway, as you know, there have been studies with the COVID virus where the virus was manipulated, the genetics of the COVID virus was manipulated, and then they humanized mouse lungs and to see which strain of the COVID virus would be more deadly to the humanized lung mouse. Why can't that happen with the bird flu? Somebody nasty with a lab takes the virus with new techniques like CRISPR and similar technologies. They may be able to have numerous sequential mutations occur and then potentially let the virus out. I mean, is that a possibility, or am I talking science fiction?
No, I think theoretically you are absolutely right. And we have no influence on how experiments are done in China or in Russia, for that matter. And you're absolutely right. However, I like to see it from a different angle. I think we in the US and in Europe should be allowed to do those kinds of experiments because we can learn how we deal with these rogue states, and we have to, I think we really have to understand the system in such a way that we can find a better vaccine or a better antiviral. And by preventing the work in the US and in Europe as well, to make the science more difficult, I feel we should rather be more lenient and more flexible in our system because we want to learn and know as much as possible about what could be, how it could be misused or abused, and what can we do. And we should really be, by our own work, we should be able to contribute that this be prevented from becoming a real problem. So I like to argue that these gain of function experiments are important ones in terms of learning more about the system, learning more about how we can prevent it from jumping into humans, and how we can protect our own population.
Yeah, the problem I envision, and again, I'm not an expert in this field, is it seems like it's becoming easier and easier to manipulate the genetics of the virus in a laboratory over shorter periods of time. So even if we do come up with more information about more virulent or pathogenic strains, the only defense we have for those is vaccines and antivirals. So it's easier to make nasty strains of the virus, but then to get a vaccine approved for them takes years of work and clinical trials and FDA approval. So, are we setting a trap for ourselves by doing that?
I would like to sort of mention what we in terms of scientific community and also the government, we were able to do in terms of COVID-19 vaccines, that a major breakthrough with these, quote, mRNA vaccines allowed us to have a fantastic vaccine within a year.
Right.
And we would never have, if you would have asked any of us 5 years ago, is it possible to get this done?
Impossible.
So I feel that the progress, and this was not, the mRNA was not that just someone had some idea. No, this was a painstaking research for many, many years.
Right.
And so I think it paid off that we had the support, that the government actually financed it, whatever, I think it was Warp Speed,
Right.
which was very, very important. One might think about politics as you want, but this really has helped, has saved millions of lives. And I think by allowing these gain-of-function experiments, we will be better prepared for a future situation like COVID-19.
Right. Are you working with live virus in your lab?
Absolutely, yes.
You are?
Yes, yeah.
Oh,
sure.
all right. I'm
Yeah.
going to stay a little further away.
I'm still alive. Yeah.
Right. You look very well. That's great.
Yeah.
How do you make sure you don't have, let's say, a rogue employee or somebody who's decided that, it's time to do something very bad?
I think it's not that easy.
No?
I mean, to be quite honest, I mean, if you would tell me, make something which is very virulent, I wouldn't really know how to do it. I think the 1918 virus, I think nature was much smarter than I would be, and also I think a postdoctoral fellow who is disgruntled, I don't think would be that easy to
do that
over the weekend. And so it's, I think...
What a relief.
I think...
good to hear that.
I never had any problems, all my
you've been doing this for decades.
And I have been, and we have really been blessed in a way that we hadn't had any escape or anything.
Right.
So it's pretty... but we have very good facilities at Mount Sinai, so I think that also
that helps.
And I mean, laboratories are. I mean, people know what we do it, and we watch each other, and so I don't think it's a very likely.
Extremely
scenario.
low risk.
I think so. Yeah.
All right. By the way, in the introduction, I mentioned that you reconstructed the 1918 flu virus. How did you do that decades later? How's that possible?
So the virus was extinct in 1918. Obviously, when we did this was like 70 years later, and the virus was not living anymore. But what happened was that the Armed Forces Institute of Pathology, Walter Reed, in D.C., in Washington, they had pathology samples of soldiers who died in 1918.
Wow.
So they had lung samples, they had kidney, they had all, and they were very good, the pathologists. They had brain samples. And from these samples, which were in a paraffin block, it was possible with this new polymerase chain reaction, PCR, which is also used for detecting viruses. Using this polymerase chain reaction, it was possible to get the sequence of pieces of the RNA. So the virus has long RNA pieces, but over the 80, 90, 100 years, the RNA it disintegrated, but it was still in long enough pieces so that one could sequence these pieces, and then by knowing other influenza viruses, we were able to reconstruct the sequence first and then reconstruct the virus. And I was able to develop a technique at Mount Sinai which we refer to as reverse genetics. It is a way from based on the sequence, and we have to go through DNA to make an RNA virus. It's not a very interesting or clear name for what we are doing, but reverse genetics means we put everything into DNA and then make the virus from that DNA. And we were able to reconstruct that virus without having that virus it wasn't in a refrigerator. There were no refrigerators in 1918, so it was not that this virus was around anymore. And but we could use a technology based on sequence, and the sequence was obtained by getting these materials. And there was also an Inuit woman in Alaska who actually was pretty heavy. And she died actually in 1918 of the virus and was buried. And because she was fairly, let's say, heavy, the permafrost, the grave they dug, the lungs were always protected from somewhat more fat around. So if she would have been,
amazing.
If she would have been very slim, probably during the summer that the lung would have warmed up. But in this case, in this one situation that I don't want to say fat lady, but that was the explanation that the virus was still more preserved than it would have been otherwise, and also material from that woman was used to sequence.
So did you actually create an entire virus particle with the glycoprotein,
Absolutely.
everything?
The hemagglutinin, everything,
And
yes.
where is that virus?
Okay, we started out, so you have the virus and the genetic information. So we started out with putting 10%, 20% in and looked, how does this virus change? And one of the first experiments was we wanted to know whether Tamiflu would help, and we found that the virus was perfectly sensitive to our drugs. We also made a vaccine right away because we didn't know if the virus would be immune suppressive, for example. So we checked it right away in mice. So we did first components of the 1918 we put into the current one, but more importantly, the actual experiment where all the genetic information was from 1918 was done under a BSL-4 facility at the CDC, Center for Disease Control. And only afterwards, when we understood and knew that vaccines work, that antivirals work, etc., and that we all still have antibodies against H1, that we would not be as helpless as in 1918. It was downgraded to BSL-3, and we have, for example, at Mount Sinai, a BSL-3 facility, which we are now allowed to grow this virus.
Wow, that's
so it was very carefully done,
story.
And we have really learned it. I mean, I spent 7-8 years on that, studying the virus, why it was more pathogenic than others, and also to find out where its vulnerabilities were, namely that our vaccines, our antivirals, and we knew that this virus wasn't sort of a monster. We
Right.
found that it was really very similar to our present viruses. The problem was that we had no antibiotics at the time, and we didn't know what the hell it was, etc.
Right, bad time. Now, you're working on a new vaccine
Yeah.
for several years that would cover all the strains pretty much of the type A influenza virus.
And B as well, yeah.
B as well.
Yeah.
And I've read about it, and it's very interesting. You have the stalk protein, basically, of the hemagglutinin, and then you have the head. And my understanding is the head changes frequently, and that's what the current vaccines do. That's why they have to change all the time. But if you can get a vaccine to the stalk of the hemagglutinin protein, then that could last forever for multiple strains. Is that correct?
You described it very, very well. Our approach is that we look for conserved domains of the virus, which doesn't change for 10 years or 20 years or maybe even in our lifetime, and make a vaccine which induces in the vaccinee, in the person who gets vaccinated, an immune response against these conserved domains which happen to be in the stalk.
So the part of the virus that stays consistent over the years is what you're developing a vaccine to.
We make a vaccine against that conserved portion, and that's what we are doing, and we are in phase 1, 2, 3 already, but it is very, very time-consuming. And in a way, we were lucky that the COVID-19, everyone was really, including the FDA, said, hurry up, hurry up, hurry up.
Right.
In this case, with flu, we have very good vaccines, and therefore, I don't want to say less of a risk is taken or is allowed and is justified, or we had more of a risk against, well, it was allowable to have more risk with COVID-19, because we didn't know what.
Right, had no choice.
But with flu, we have antivirals, we have good vaccines. So therefore, a new vaccine, which the only advantage would be that we don't have to take it every year, but it will last 10 years, 20 years. So one really wants to be safe. We want to be absolutely sure that this is a safe vaccine and doesn't cause any problems.
Will the vaccine be an injection of the stalk protein or inactivated virus? Or
all of the above. We
All the above.
we are actually agnostic about the platform. We are even thinking of having a spray,
Inhaler.
and inhale it, or intranasal, either one, or just the stalk alone as a protein, or so the platform we are fairly any which way it would work, yeah.
Right. And that would be effective against H5N1 as
And
well.
it should be effective against H5 as well.
When do you think that might come out? I know it's impossible to predict
we
exactly.
A journalist told me once, never give a year, never give. Don't predict anything in this business, and
Right.
so I would say it is slower than we would like it to do, and in a way, if the kind of effort and kind of money we had for COVID-19, we would have a universal flu vaccine already. Yeah? I'm not complaining, but
Right.
that's a reality. Yeah?
Right. So it's not going to be another mRNA vaccine.
As a matter of fact, we also have.
Oh, you're working on that too?
We are using mRNA to provide
The protein.
the conserved protein. Yeah.
Oh, that's very interesting.
Okay.
Now, I know you're also working on COVID vaccines. Tell us about that.
And there again, we have the mRNA vaccine by BioNTech, Pfizer, BioNTech, and Moderna. they are fantastic vaccines. Okay, so they were developed in extraordinary speed. They are really very, very safe, and they are, I think, God's gift, God sent. Yeah, it's really fantastic. However, there is sort of a niche. These mRNA injected vaccines do not induce a lot of a mucosal immunity.
And that's where the virus lands.
That's where the virus lands.
Right.
So if you can make an immune response of the respiratory tract, then I think the breakthrough infections would be reduced, and also the transmission from one person to the other would be reduced, because if we have an immune response in the upper respiratory tract, then the load in a particular patient is less.
Right.
And therefore,
the virus is killed immediately on entry before it can replicate in the lungs.
So if there's a, let's say, 1,000-fold lower titer in my respiratory tract, then as compared to someone who has not been treated with, has no vaccine, has no immune response, no mucosal immunity, that transmission would be reduced. So breakthrough infections, that people who get infected get the disease, in mucosally vaccinated patients, that would be reduced, and therefore we are working on a mucosal COVID-19 vaccine, and we are using a vector virus which has the spike protein of SARS coronavirus as part of the vaccine, and we administer it through the nose, and hopefully that will improve the mucosal response, and therefore reduce transmission and also breakthroughs.
Yeah. So speaking of that, I have many patients in my practice who tell me they had COVID after 4 or 5 boosters of the vaccine. Why is that happening if the vaccine is so good? These are people who've had numerous boosters and they still get sick.
I mean, you know, there's always in the distribution, there are some people who are more, let's say, sensitive to and get it more frequently. However, vaccinated people, when they get the disease, the level of the severity is reduced, and that is something which very few people know, or very few people understand really, that if you get vaccinated, then the likelihood of having severe disease or die is much reduced. And so therefore, yes, you may be reinfected, I don't know, about 5 times, but I'm sure it happens, but let's say even twice. But I think those 2 times will be much less severe than if they would not have taken the vaccine.
Right. So it's unlikely they're going to die like initially when the pandemic started. People were dying from it because they had no immunity at all.
Sure.
So it's not a perfect vaccine, but you think it's helpful?
I think it's very, very, and particularly as it reduces severity of the disease and reduces the death number. Yeah.
Right. There have been some reports, I don't know if they're accurate or not, that the COVID vaccine RNA somehow stays in the body for long periods of time. They've shown it to grow in hepatocytes in vitro.
Okay.
And do you believe this, or you don't think that's correct?
No, I'm aware of those papers, but these are very artificial laboratory conditions.
Right.
So what is correct is that if I get infected without the vaccine, that I have components of the virus, either the RNA or protein, for quite some time in serum, in blood, as well as in the mucosal areas in the lung, yeah, and unfortunately also in the brain. So we are aware of many pathology reports where they have found components of the virus, not live virus, in different organs. And that is different from flu and is of concern. I don't think the vaccine is really, this is RNA, and that RNA is not that stable. So I doubt that there are many cases where there's a long-term presence of the vaccine. What has been reported is that people have, after a natural infection, have the viral RNA and viral protein in the system, which is very unusual. It's not
Right.
with flu, it's not with measles, but it is something which I think may explain the long COVID
Right, that some people get.
that some people, and more people than we like it to.
Yeah, I have patients who complain about long-term symptoms and brain fog and symptoms like that.
Well, that,
Maybe
yeah.
it's from...
And I have to say that I'm on a National Academy of Medicine committee on long COVID, and this is already a year now, and I agreed a year ago because I thought this is more of a case for a psychiatrist, really. I mean, I don't think we should spend too much time on following this up, and I have really changed my opinion. I really think it's a real disease, and I have really changed my opinion that there is a condition such as long COVID.
So you think it could be from parts of viruses that
Parts
hang
of viruses,
out, immune reactions?
Immune reaction. I don't like the brain, that we have RNA in the brain of people who died of. So that is something which is developed. Long COVID, I think, is here to stay, and I think it is a real condition we should be very much aware of, and also try to fight against. And I think by having good vaccines, I think the number of long COVID cases should also go down.
Right. Again, I know you don't want to predict, but when do you think your nasal COVID vaccine might be ready?
We are in 2 countries in phase 3 trials.
Phase 3? Wow,
yeah.
That's good.
But not in the US. Yeah. So this is Brazil and Thailand. Yeah. So
the FDA takes longer. They're a little more
there
careful.
it takes sure. The reason we are going there is that
It's quicker.
It's quicker, and but for the US, it's still a long way to go.
Long process.
Yeah.
Let me ask you this. I'm curious as to whether you have an opinion on this. You know, there's been debate back and forth of whether the COVID virus was a lab leak or it was a spread from some kind of mammal to humans, and it just spread like wildfire. What's your opinion on that?
Let me take the 5th.
You want to take the 5th on that one? Okay, that's nobody knows for sure. It's hotly debated, as you know. Well, this has been extremely informative for me, educational. I'm feeling more comfortable knowing that you're working on the vaccines and know a lot about this virus, and it seems to me like you're optimistic that it's not going to be a pandemic that's going to spread from human to human, and I hope you're right.
Yeah.
So I want to thank you for coming today and educating me, and the audience, I'm sure, is going to love this as well. Thank you very much.
Thank you very much. It was a pleasure. Really
Thank
good.
you. Thank you.
Very well prepared. Very well prepared.
Thank you very much.
Good.